Hi, Constance. How are you doing?
Hey Sarah, how are you doing? I'm doing great.
I'm doing well. Well, I just got my second vaccine, so I'm excited for the world to open again.
Oh, too funny. I got my first a few weeks ago and I get my second one next week. So yeah,
Oh,
I've already kind of opened up the door of the world. I'm already two steps in.
good, good. Well, good luck with that. I hope you feel well. I keep saying well. I'm so excited for our guest today. We have Emily Barson, who's the executive director of United States of Care, joining us. I actually knew Emily way back when as children, and it's really fun to get to work with her again in our professional lives as she works with the United States of Care, which really focuses on making sure everyone in the country has health care. So Emily has spent over 15 years on the front lines, and she really has so much incredible insight. She's going to talk to us today about the learnings from this pandemic year, this year of COVID, through the different research that United States of Care has brought to us, and kind of what her suggestions and thoughts are on next steps.
Awesome. I'm looking forward to hearing what she's going to share. Let's get started.
Great. We're so excited to have you here today, Emily. Thank you so much for joining us. We're excited to hear what you have learned over the past year. And why don't you take a minute and introduce yourself?
Great. Hi. Thanks so much for having me today. My name is Emily Barson, and I am the Executive Director of United States of Care.
Great. How long have you been with United States of Care?
I've been with the organization since before we launched, and we launched in early 2018, so a little over 3 years ago.
Awesome. So I know you're coming to talk to us today about some of the learnings that you have coming out of a year of the pandemic. I wish I could say the end of the pandemic, but we're not quite there. Talk to us a little bit about kind of what United States of Care does at a higher level, and then what you did with this research, or what you did to gather this research.
Sure. So United States of Care is a nonpartisan, nonprofit organization. We work to ensure that everyone has access to quality, affordable healthcare, regardless of health status, social need, or income. We know that the healthcare system isn't working for millions of people in the United States, and that people want a better healthcare system. And as we'll talk about, in the wake of the pandemic, we think there may be opening for reforms that weren't possible before. We do our work in a unique way, really going around the country to understand people's needs and using that as the center of reform efforts. And we really tackle these massive challenges on two tracks. First, we're working in states to expand access to quality, affordable healthcare right now so that people don't have to wait for a perfect solution from Washington, D.C. And second, really working to create the conditions for longer term change. We know that we need to shift the national conversation and create innovative solutions and build momentum for federal change that won't be in danger of being overturned at every election. An important part of how we do our work is in partnership with an array of policymakers, advocates, business leaders, entrepreneurs, everyday people, really making sure that we have all perspectives at the table.
Yeah.
And so a little over a year ago, as COVID hit and as we realized what the scope of that was going to look like for the country and for the healthcare system, we as an organization really pivoted into helping with the response efforts, creating resources and recommendations for state and federal policymakers, standing up a rapid response effort, creating playbooks to capture both public and private sector innovative solutions that they were taking on to combat the crisis. And as part of that, really doing research to augment the listening that we had already done, to really understand where people's values were and make sure that the recommendations we put forward were aligned and framed within the needs that people were sharing with us during the pandemic.
I love that. And you said a few times that you're looking to make healthcare affordable and accessible to everyone, which really resonates with me, and it resonates with WELL. That's one of our missions as well, as making healthcare affordable, accessible, and plentiful. So we're huge supporters of you all. We love what you're doing, and we love hearing about your learnings. You bring a whole different kind of perspective than maybe we see in the day-to-day grind of the mechanics of it. So thank you so much for coming on and talking to us a little bit about it. I know you have kind of 5-ish points that really were what you think maybe are the highlights of the learning. Can you tell us a little bit about them?
Yeah, absolutely. So, we saw throughout this crisis, it's almost a cliche to say that, COVID really shone a light on some of the inequities and disparities that those of us, like all of us working in the healthcare world, have known existed. But really knowing that health equity isn't and shouldn't be a side issue, that, it really reflects longstanding inequities. The disproportionate impact of COVID is not just about COVID. And it really just underscores that solutions and reforms that we put forward really need to have equity baked in, not as a separate silo of this is the equity solution and this is the solution for affordable healthcare. So I think that's really important, and something that, we really keep front of mind in our work. I think that we saw both sides of the healthcare system, right? I think it absolutely demonstrated that it could be nimble. I think the rapid adoption of some new approaches and technology and virtual care, really probably were a decade's worth of technology adoption in the first few months of the crisis. But that, the healthcare system really needs to build resilience. We saw that, providers that were more stable when they were more based on value-based care instead of models that were more traditional fee-for-service when people stopped showing up. And so, I think that shift, and that's a momentum that's been happening in the healthcare system, but it really demonstrated the need for providers to be able to keep providing that type of care to people.
So when you talk about that the healthcare system can be nimble, are you now working with organizations to see how we can continue that? I mean, at times it felt maybe a little bit frantic, but the need was there, and whether we're talking about the speed to market for the vaccination, or the switch to telemedicine, or even this new process with in-person where there's like the check-in outside and then you do the temperature check, like all of these things changed very fast in a system that normally we see is very, lethargic or slow to take those changes. So is there anything that you all are doing, or that we can be looking towards to kind of keep that nimbleness, maybe not quite as the rate of the pandemic, but faster than it has been?
Yeah, and I think it's important, as you said, it was really this quickness of need that, everything, people couldn't show up, so we had to figure this out. And certainly some of the regulations were loosened, or some of the cross-state things that providers were able to do that maybe they'd been asking for and only became possible during the pandemic. We are, I think, at a point where we can pause and sort of evaluate what these changes meant. One area that we are looking at in particular is virtual care. We have this vision for what the healthcare system should mean for people. And part of that is that people should be able to get the care they need when and how they need it. And I think virtual care has been an incredible tool for advancing that vision, but also, sort of having a pause and making sure that the rapid adoption and the technology is a way to actually address the gaps in access. To my first point about equity, that this is something that actually makes healthcare more accessible to more people, not just making it more convenient for people who already had access.
So Emily, I have a question on that. I've been thinking about sort of the economics of the current health industry model. And so one of the foundations of our healthcare system are these big buildings, right? The hospital beds, the facilities, the on-site in care, and that's a big part of the economic model of, half of the health system, right? Half is getting insurance, the other half is taking care of people. And, up until COVID, basically, we wanted to fill those rooms up and we wanted to build more rooms. And in fact, they're still building more rooms. As I travel around the country, I'm shocked by how many huge facilities are still being built, right? Brick and mortar. And it's ironic that, in a time when virtual is available, like let's take that back to the .com, when everything went virtual, we didn't build more bookstores. We actually built less bookstores, and we changed bookstores into coffee shops or whatever it might be. Have you seen, and especially because you deal a lot with the rural areas where the equities are in many cases greater and the social isolation is, prevalent. Have you seen any thinking around the shift of how do we take this incumbent model of brick and mortar and really change it to the virtual model? Like, I understand that the virtual model is being developed and is working, but that kind of leaves, a part of the industry behind. And I'm just kind of curious what you see in terms of you repurposing those facilities or aggregating other ways to serve those members that will make up for that economic deficit potentially for those systems.
Yeah, it's a great question. And I think somewhat, remains to be seen. There was such a scramble in one direction. And, we've been, as I said, really digging into different elements of the virtual care adoption and what it means. And I think really what we're seeing and what people are reflecting back to us in our conversations is a need for really a hybrid model. People want to be able to do a quick virtual care visit. I think there are also a lot of potential for more monitoring and tracking at home with the right equipment and technology. But that doesn't mean, that we don't need these physical brick and mortar spaces. I think, we saw a ton of deferred care over the last year or two when, people were afraid to show up or were getting appointments and you're right, and surgeries and everything canceled. That is just now reverberating, right? We're seeing the results of a year of not showing up for, elective surgeries and other appointments, let alone, dentists and other things that, are still going to be needed. I think the .com analogy is a good one, but also only goes so far because there's elements of the healthcare system that absolutely do need to be in person. And so I think that's going to be probably the next few years of calibrating what that hybrid model looks like and what model best serves people. Some people don't want to do virtual care at all and feel like that's not the personalized care that they want. Right. And some people feel it meets their needs better. So, I think finding that model is going to be really important.
Have you all found that there's certain segments of the population that are more interested in virtual care versus those who really want the brick and mortar personalized touch?
Yes, and we're digging into that. We actually have done a playbook and a deeper research specific to older adults. And I know there's been a lot of question about, whether older adults would adopt. And certainly we found a big portion of that population was open to and had used and had good experiences with virtual care. But again, really wanted to know that they could see their doctor when they weren't going to be pushed into virtual care as the only option. And so I think finding that balance will be an important piece of, providers and practices that are partnering maybe with these great technology solutions, but also can give that personalized attention.
Yeah, I could talk about virtual care for hours. I find it fascinating. I find, all of the wearables that you can have and that you can track yourself from home. But I know you have some other learnings, so I want to make sure we touch upon those. So what are some of the other learnings that you guys have discovered over your research this past year?
Yeah, absolutely. I mean, I think really what we've seen is the need for durable and dependable coverage options, especially as life changes. And in particular, over this past year, we've seen the fragility of the job-connected health insurance system at a time when millions of people were simultaneously losing their jobs or having insecurity in their jobs while going through a health crisis. And, I think that has been, it covers more than half the people who have health insurance in this country. And it is, certainly been a foundation of the coverage system. But I think it really showed the need for additional, solutions and options that make it affordable for people to to move jobs if they want to, or know that if they lose
Right.
their job, that there are other options out there. We've been working on some public options at the state level in places like Colorado, Connecticut, Nevada, all with slightly different approaches, but all with that goal of offering options that people can afford and give that sort of sense of freedom to move. Obviously, there are other approaches, easy, affordable enrollment, like what you all do, I think is important and makes the system more accessible for people to get the help that's out there. And we've seen the rescue plan, boosted the subsidies. We're hopefully those will become part of the longer term landscape. But again, with the sort of durable coverage that people can count on, they know those additional subsidies are there for some time, and need to have the security to know that it's there longer term.
Have you done any research or looking into ICHRA, the individual coverage HRA? It's kind of the quote unquote group coverage that can go with you. Is that something that you guys have looked into at all as part of this?
That we have not been as active in that space. I know, it's certainly another area that is important to look at in the sort of spectrum of options, and that portability is really going to be key. And for things like this, when there is this big disruption, but also just with the reality of what the workforce and what people's jobs look like these days, and the reality that people don't stay decades at one job, and have that sort of continuity and durability of their coverage in the way that they did in decades past.
So Emily, you talk a little bit about in your research, kind of, our values around believe that all should have access to health care, and sort of the, the equity issue, which brings everybody to the table. Where have you found some of the walls breaking down in terms of like an us versus them approach, or this group but not that group, right? Like, these are the ones we want to focus on, and these are the ones that are either just too difficult to bring into the fold, or they're not coming to the table. Where's that division still there, and where do you see it actually being broken down and coming together?
Yeah, that's a great question. And certainly for the last, almost 2 years, and starting before the pandemic, through a variety of methods, we've been listening to people both at kitchen tables in the before times and virtually, and in more, traditional survey type research. And we've been listening for really both the shared needs and values and where they diverge. And what we found, is really across demographics, a lot of commonality, really that the anxiety and confusion and hyper politicized nature of the conversation around healthcare prevents people from getting their needs met. That unsurprisingly, cost is the number one concern really across the board, people in all different types of demographics and situations. And that dependability, right? That people are worried their healthcare will disappear if something bad should happen. And I think one that was really interesting and was flipped on its head during COVID is, how alone people feel in navigating the healthcare system. I mean, people came with their stories of, all these different challenges and felt like they should have been able to handle it better, or like they were the only one going through this. And I think in that's sort of another, theme I would pull out from this last year is really that our health and our values are connected, that we should care if our neighbor has health care and is healthy, that, it's really a lot of shared interdependence and experiences at a time like this. And so, we really try to focus on those areas of shared values, and seeing where we can draw on that, while lots of other people have interests in, finding the areas of divergence.
I really like that, and that resonates with me a lot. I think in a lot of ways over this past year, we did focus on these shared experiences, even outside the world of healthcare. I know there was the Rainbow Heart movement where, at least the school children were kind of across the country told to put these rainbow hearts in their windows, for even like the mailmen, the people who had to be out when the rest of us were hiding at home. But that there wasn't that same kind of camaraderie, watch out for your neighbor type of feeling for in the healthcare world. So that's on a personal note, I would love to see us continue that. Yeah, I mean, it's crazy. And you were talking about the cost. The other thing with the cost, and I think it's something that, well, I know it's something Constance and I talk about a lot, and I think it's something we're going to bring to one of our future podcasts, is just understanding the cost. You know, when you talk about the shift from group to individual, you don't have to understand quite as much with group. It's kind of done for you. But then with individual, you're looking at all of these terms that maybe you don't know, and you've got your premium, but that's only one cost. What about your copay? What about your deductible? What about so many other things? So I hear you. You know, before I really got involved in this world, I had no idea what they meant. So I'm looking forward to bringing some people on and at a future date to really define all of this for us. There won't be a test, but we'll define it.
It'd be interesting to pull from United States of Care a new vocabulary. I mean, we know that you know, the FAQs are out there on what is a premium out-of-pocket deductible, et cetera. But you know, there's obviously new terms and new concepts that people are not informed of and are unaware of, and really, again, can bridge us in a new language that we're going to have to share because it's new. Like, it's new to everybody. It's not, you know, the old stuff that everybody else already knows if they've been in the industry. This is all new stuff. Virtual care was not a concept, you know, really even 5 years ago. It was kind of a, you know, corner discussion, like, have you tried virtual care? Oh, what's that? Well, now there's a whole new vocabulary that has shared need and shared opportunity and drives a shared conversation.
Yeah, no, I think that's great. And I think exactly what you're all getting at is, you know, saying that people, you know, have the certainty they can afford their healthcare is not just about a premium number. And, you know, there's a lot more that goes into it, which is why it's both important that, you know, not just coverage numbers don't really tell the whole story. And, you know, we've been working as an example we've been convening a cross-state collaborative on affordability, and a lot of states are looking at affordability standards and talk about wonky vocabulary that's sort of right up there, but, you know, really looking at that full picture of what people have to pay and how they even define affordability in order to have, you know, their policies reflected and enforce it. And so we've been able to, you know, sort of have the states learning from each other, and also, you know, thinking about where there are themes and lessons that can inform other states, as well as be part of that shift in the national dialogue.
Well, even think of the word disparity, I mean, or social isolation, you know, those are not healthcare terms at large. So now they are. Now there's health disparities, right? There's Z codes so you can bill for health disparities. There's a whole new layer of, let's call it, you know, justice for all, right, to the United States of Care, you know, theme that does require a new conversation. And I mean, thank goodness there are organizations like United States of Care who are really platforms for provoking and, you know, amassing those conversations.
Yeah.
Well, thank you. I think it's such an important conversation that has turned so much into, well, if you believe this, you're not with me. And what we're really trying to do is step back from that. And I think that's a great way to put it, you know, have that new vocabulary, you know, talk about healthcare in the way people actually talk about it within their own families and when they're making their own decisions, and use that as the starting point for what lawmakers should be thinking about.
Yeah. Well, Emily, I know when we first asked you to be on this podcast, we talked about, like, let's make sure we use the language that everybody knows, not those of us who are diving in it today. And certainly I think we did that today. Thank you so much for joining us. I find this fascinating, you know, the research that you all are doing, the work that you're doing. I hope that you'll come back and talk to us again as you learn more. And I really appreciate your time today.
Thanks so much for having me.